Stacy Tyler, Capella University, Managing Health Information and Technology, Dr. Gina Mayakako, December 14th, 2020. Hello, my name is Stacy Tyler and I'm a nurse with Mabelina Healthcare. I want to welcome you to our team and I will be discussing with you nursing sensitive quality indicators, also known as NDNQI. We will be focusing on hospital-acquired pressure area rates with processes and outcomes for our facility. I have researched the latest material on the subject as well as consulted with our wound nurse, Benelli Remington, and she was kind enough to give me an interview that I will share with you. Hopefully by the end of this audio, you are able to fully understand your role as a nurse here at Mabelina, supporting valid reporting resulting in enhancement of outcomes. First, let us begin with the NDNQI. What is it, you may be asking yourself? As described in a 2020 article from the Journal of Nursing Care Quality, simply put, it is part of a safety and quality initiative that was established in 1998 by the American Nurses Association that examines relationships between nursing care and patient outcomes. In an article by Nursing Leadership in 2018, the authors state that the nursing sensitive quality indicators are outcomes influenced by nursing care that have evidence linking their care and interventions directly to the outcomes of the patients. The authors go on to say that most organizations that follow the NDNQI create scorecards that help to evaluate the progress of these indicators and therefore help to make the necessary changes towards their goals. Like earlier mentioned, we will address the pressure area rate hospital-acquired indicators and the processes and outcomes of them. This is particularly important to monitor because it is a quality healthcare issue that affects patients and the hospital in disastrous ways. Bale, Gross, and Draper described in a 2015 study that pressure areas were found to increase hospital costs by $226 million nationwide because of lost revenue due to additional care costs from elongated stays. So not only does this multiply the risk to patient safety, but lost revenue can be monumentous to the facility. New nurses need to be aware of this quality indicator because they can literally affect the end results in a positive or a negative way. In a 2019 article by Kahn and Jonasis, they stated that there needs to be an interprofessional team approach and organizational support in order to succeed in pressure area prevention. By understanding that, each team member can make an impact and work together to achieve the best results for the patient. As one unit, we can put a large so-called dent in hospital-acquired pressure area incidences. During my interview with Nurse Benelli, we discussed how our hospital collects data and the hospital-acquired pressure area indicator. Pressure areas are also referred to as pressure injuries. The abbreviation for pressure injuries is PI. Although patients do come in with PIs, we tend to focus on tracking the hospital-acquired pressure injuries, which is abbreviated as HAPI, within the NDNQI. Next, she guided me towards a table that we follow in order to keep accurate records of the PIs. The table is a representation of the nationwide NDNQI HAPI risk and prevention measures. In the 2020 Journal of Nursing Care Quality, it shows the exact table on page 183 of their article, which is translated as the following. The table has two columns. One side represents the HAPI risks, and the other side represents the HAPI preventions. The primary admitting nurse is responsible for measuring the risks of a patient acquiring an HAPI by assessing 5 elements. The findings are entered into the charting system specific to the NDNQI. First, they must perform a skin assessment and a PI risk assessment within 24 hours of admission. They must note the time since the last PI risk assessment and list the last PI risk assessment scale and score. Finally, they must notate what the PI risk status is. From there, the interdisciplinary team will formulate a care plan to address any issues. For the preventative measures side, the admitting nurse must measure the PI prevention use overall within the last 24 hours and again include a skin assessment. They must list a pressure redistribution surface that will be used in the last 24 hours. There needs to be routine positioning as prescribed and notated within the last 24 hours. And finally, nutrition support and moisture protection as listed in the last 24 hours. Benelli said the primary admitting nurse will perform all of these functions if she is not there. But if she is there, then as head wound nurse, she will perform them. Each week, the preventative list is reevaluated and updated. Any changes to the list will be notated and reported. There is a monthly account of all the HAPI reported, and this is done quarterly and yearly as well. Benelli explained that it takes the entire multidisciplinary team and cooperation and data collection to help prevent and treat the HAPI. The healthcare organization uses the NDNQI to help make this happen. McInnes, Peters, and Bonney said it best in a 2015 article from the Journal of Advanced Nursing about teamwork. They said collaboration between healthcare professionals has been shown to improve patient satisfaction, increase positive health outcomes, and reduce overall healthcare cost. The multidisciplinary team involved would include respiratory and therapy staff, registered nurses and wound care nurses, as well as nursing aides and management. The nurses and nursing aides would be responsible for assessing and maintaining the wound care with their preventative strategies. Respiratory staff and therapy staff would come into play as needed, and the management staff would continuously evaluate the circumstances and enhance and revise as necessary. Something we abide by here at Mabelina is an evidence-based practice utilizing a turn schedule for the patients. This turn schedule involves all disciplines and assists the patients in being turned every 2 hours so as to prevent a pressure injury from forming. Kahn and Jonasis performed a study in 2019 using the NDNQI. They explored the benefits of turning patients through their evidence-based research. It is disclosed that the incidence of HAPI decreased by utilizing turn teams. Turn teams were designated people at assigned times that would assist each other in turning patients in a timely manner so that their skin would not form a pressure injury. Their research concluded that by assigning teams, it took the burden off of searching for help at random times and increased the turning ratios for the patients, thus improving their outcomes of PIs with meaningful prevention. Benelli said that by following the NDNQI, it has eased the process of collecting data and entering it into the database because they have specific criteria that they meet. We are grateful to be able to use the computer system as a patient care technology to enhance our outcomes. However, the data entry must be accurate. A study from the Journal of Advanced Nursing about how a data registry program can improve the quality and safety of nursing practice in 2019 stated that patient outcomes are determined through the pivotal data measuring and reporting. The study found that when the charting was precise, the patient's favorable outcomes were increased. However, with improper training and invalid data entry, patients' outcomes were affected negatively. This drives home the fact that technology can help aid us swiftly towards our goals, but if not used appropriately, it can misconstrue information as well. Benelli suggested that everyone just needs to follow the charts and questions accordingly. After the training you will receive, you will understand clearly how to follow the NDNQI. The challenges she says that she experiences are when nurses don't report changes in the patient's conditions or they chart incorrectly and the HAPI declines without her knowledge. This causes unnecessary harm to the patients and they risk their safety. You as a nurse will take part in making sure these tasks are performed precisely. You will be in charge of noting any changes in your patient's skin to Benelli, the wound nurse, the doctor, and reflect in your charting so that others may follow in line with appropriate outcomes. Be mindful that this task, although it may seem small, is mighty in importance. Latimer pledges a gentle reminder from the 2015 Nursing Open Journal that every patient is at risk of developing an area as a result of a hospital stay, and that pressure area care is an essential component of nursing care. In conclusion, the NDNQI are there as a guideline to aid in the safety of our patients. We are given the tools we require, but we must work diligently as a team to adhere to the quality indicators. Data collection and analysis are essential in conserving favorable outcomes for the patient in satisfaction and health treatment. Remember, we are all in this together, and if anywhere along the way you need help or have questions, feel free to reach out to myself, Benelli, or your charge nurse for assistance. We need you, we rely on you, and we welcome you to Mabelino Healthcare.